Today, Carly, Sam, Jill, Elaine, and I will be debating the Telehealth Modernization Act. This act was introduced into both the Senate and House on February 23rd and February 25th, 2021, known as S368 and HR 1332, respectively. The bill would amend Title 18 of the Social Security Act, making the telehealth flexibilities created during the COVID-19 pandemic a permanent addition to the Medicare program. This bill helps to make the provisions introduced during the pandemic permanent so that healthcare professionals can continue to provide necessary care via telehealth regardless of originating and distant sites. The original sponsor of S368 was Senator Tim Scott, and the bill has gained 13 co-sponsors since February. For HR 1332, the original sponsor was Representative Earl L. Buddy Carter, and there are now 74 co-sponsors. S368 is currently in the Committee on Finance, and HR 1332 is currently in the Committee on Energy and Commerce and Committee on Ways and Means. We will now move through our debate structure as seen on the PowerPoint slides.
There are numerous benefits of the Telehealth Modernization Act that must be considered, as they have the potential to impact the health of individuals, communities, and populations, as well as our healthcare system as a whole. The use of telehealth as a service delivery method during the COVID-19 pandemic has been perceived positively across the country, demonstrated by a 2021 survey from the COVID-19 Healthcare Coalition that revealed a patient satisfaction rate of nearly 80%. This same survey also revealed that more than 70% of individuals expect to access virtual care post-pandemic, which is an expectation that can become reality through the passing of this bill. Multiple health and wellness programs have been delivered via telehealth and have resulted in positive outcomes, including a physical activity coaching program for individuals with Parkinson's disease and caregiver wellness programs. While there are many advantages of the Telehealth Modernization Act, the three that we will be focusing on today are that it can help to reduce the spread of coronavirus and other infectious diseases, allows professionals to see the client in their own home environment, and will increase access to care for many.
Expanding telehealth Medicare coverage past the declared state of emergency is impractical without considering and analyzing the legal, ethical, and professional implications associated with using a digital platform for healthcare services. Due to being in a state of emergency, certain legalities were waived, such as licensing laws and HIPAA violations, which allowed telehealth to be effective. However, these laws will be reenacted once the state of emergency is over, affecting the practicality and accessibility of these services. Telehealth will now pose serious legal, ethical, and professional repercussions if not regulated. Yes, telehealth can be beneficial to some individuals, but it is not deemed medically necessary for the majority of diagnosis, and these statistics for whom it is beneficial for are overshadowed by the potential repercussions that may occur.
Our first argument supporting the Telehealth Modernization Act is that utilizing telehealth as an additional form of delivering healthcare helps to reduce the spread of the coronavirus and Delta variant, along with other infectious diseases such as the flu. As of right now, the CDC has reported 40,345,484 total COVID-19 cases and a total of 649,299 deaths due to the virus. The CDC also reports that the Delta variant is 2 times more contagious compared to the original variant. This act supports the need for telehealth to continue being delivered to Medicare recipients who are at a higher risk of contracting diseases. The CDC suggests that around 95% of deaths related to COVID-19 occur in individuals over the age of 45. According to Colbert et al. 2020, telehealth has allowed patients to practice social distancing guidelines and self-quarantine from crowded doctors' offices to prevent the spread of the virus. Telehealth allows older adults and individuals with pre-existing medical conditions to avoid unnecessary exposure to maintain their health. According to the Kaiser Family Foundation, 92.6 million individuals in the US ages 18 and older are at a higher risk of developing a serious illness if they contract the COVID-19 virus, either due to older age or pre-existing conditions. This demonstrates the need for the provisions introduced during the pandemic to become permanent so that healthcare professionals can ensure the safety and wellness of their patients and provide the necessary care they need without risk.
One major obstacle of the Telehealth Modernization Act is state licensing laws, which originally required the healthcare provider to only deliver telehealth services to clients located in states that they are licensed to practice in. During the COVID-19 pandemic, state licensing laws were suspended, allowing clients to receive telehealth services from their providers regardless of the states they were licensed or located in. However, when state licensing laws are reinstated, clients will no longer be able to access telehealth appointments if their healthcare providers are not licensed to practice in that state. For example, someone living in New Jersey could easily travel to Philadelphia for an in-person appointment. But after the suspensions end, if their provider is not licensed in the state of New Jersey, they will not have the option to have telehealth visits with them. The American Occupational Therapy Association is currently in the process of creating an interstate professional licensing compact to allow OTs and OTAs to practice telehealth across state lines. However, this initiative is set for 2024. Until this happens, many individuals receiving Medicare may face barriers when trying to access telehealth appointments with their regular providers.
The second point in support of the Telehealth Modernization Act relates to the benefits that result from being able to see a client in their own home environment. Among other things, this bill will allow the home of a beneficiary to serve as the originating site for all services, rather than only for certain ones. The American Medical Association expressed their support for this bill and highlighted a critical advantage of delivering healthcare services via telehealth. Specifically, the association emphasized that the use of telehealth provides access to real-time information about a patient's social determinants of health, including their physical living environment. Having the opportunity to see a client's physical home environment can assist healthcare professionals in collecting holistic background information and in developing appropriate treatment plans. For occupational therapy practitioners, having access to the client's home is particularly valuable, as it can allow them to observe the client engaging in occupations such as ADLs and IADLs in their natural environment. As a result, they may have a better understanding of any specific home modifications or adaptations that may be necessary. Weiss et al. In 2020 further conveyed the benefits of seeing a client in their own home, stating that video telehealth visits can be used to complete a real-time safety evaluation and address safety needs. For example, their gait evaluations revealed navigational obstacles in the home that increased risk of falls and injury, and their medication reviews allowed them to see how medications are stored in the home. Observing a client's home environment in real time through telehealth enables healthcare professionals in many disciplines to gain insight into factors that can have a major influence on the individual's health and well-being, thus demonstrating the importance of the Telehealth Modernization Act.
When considering expanding telehealth coverage, it is important to be aware of the legal and ethical concerns surrounding using online platforms for treatment services. During the declared state of national emergency, the U.S. Department of Health and Human Services issued a notification of enforcement discretion which protected healthcare providers from being subjected to penalties for any violation of the HIPAA privacy, security, and breach notification rules. This discretion was put into place because HIPAA rules cannot be enforced on some of these video platforms being used for telehealth, which put private health information in a position to be breached or illegally accessed by an outside party. Some of these platforms, which are non-HIPAA compliant, include Apple FaceTime, Facebook Messenger video chat, Google Hangout video, Zoom, and Skype. This enforcement discretion will most likely not continue after the state of emergency is declared over. Therefore, even with Medicare extending telehealth coverage, there is not systems in place to protect clients' private health information on these telehealth platforms. According to the 2021 Healthcare Breach Report run by BitGlass, from 2019 to 2020, there was a 55% increase in healthcare cybersecurity breaches, which reached the highest number of cybersecurity breaches in the country to date. Therefore, extending telehealth after the state of emergency is declared over is a huge ethical and legal risk due to the large increase in potential exposures of private health information.
The third major advantage of the Telehealth Modernization Act is the increased access to care. It would protect access to healthcare in rural and underserved areas, as well as remove the geographical restrictions that are currently placed on telehealth use. Telehealth has the ability to reduce inequalities to accessible care to individuals that would otherwise not receive it due to factors outside their control. According to the Commonwealth Fund in 2016, half of the adults in the United States reported struggling to obtain health care during the evening and on weekends. This impacted the amount of people who sought out preventative care and led to greater number of emergency room visits. Furthermore, a study completed by Donnellan in 2019 found that 63% of patients and 59% of clinicians reported no significant difference in the quality of the visit when using telehealth. Additionally, patients preferred virtual synchronous sessions compared to in-person visits due to convenience, length of visit, and travel time. Another study by Stoneswell and Comans looked at failure to attend rates and found that these rates, also known as no-shows, were almost twice as high for in-person appointments compared to telehealth appointments. Additionally, it's more than just being about convenience. Telehealth can significantly benefit individuals that experience transportation challenges and those with physical disabilities with limited mobility. Even after the current public health emergency ends, this act would provide more convenient and accessible care to individuals who may otherwise not be able to receive it.
Finally, the Harvard Business Review conducted a telehealth study in November 2020 and found that while telehealth was effective and convenient for younger clients, it is not for everyone, especially older adults and those with chronic conditions. The first challenge that the study identified was a lack of access to the internet or appropriate telehealth devices. 40% of ChenMed's patients lacked a smartphone or tablet, and 60% of Landmark Health's clients did not have appropriate internet access. Although companies responded by delivering tablets to patients, this process is costly and time-consuming. A second challenge was digital literacy. Landmark Health reported that of the patients who had the appropriate telehealth resources, only 50% were knowledgeable on how to effectively use these devices for telehealth visits. The company tried to resolve these issues by holding mock visits and having telehealth ambassadors. However, this limits their productivity rates. The final two challenges were related to the client's conditions. The study found that a significant portion of the older adult patient population had medical conditions that limited their ability to participate in telehealth appointments, including dementia, hearing impairments, and visual impairments. Similarly, healthcare organizations have realized that telehealth is not conducive to those with high-risk chronic conditions that require regular monitoring of their vitals using equipment like blood pressure cuffs, weight scales, and pulse oximeters. These devices may be ordered and delivered to the client's home. However, in-person treatment is more efficient, appropriate, and cost-effective for this patient population.
The opposing side brought up valid concerns with the use of telehealth. Some patients need to be treated in person in order to receive the best quality of care, and we acknowledge that this bill is not meant to replace in-person visits altogether. However, in 2019, Donnellan found that for those deemed clinically appropriate, telehealth was just as effective and even preferred in fields such as psychiatry, neurology, cardiology, oncology, and primary care. As the opposing side pointed out, cognitive conditions may impact one's ability to effectively use telehealth technology. However, research from the University of Michigan shows that with proper training, there are promising opportunities for telehealth to be used by older adults. Furthermore, alongside with this expanded access to telehealth, we recognize that Congress must continue to support the expansion of high-speed internet access to rural and underserved areas. With regards to HIPAA, even after the state of emergency is declared over, there still will be many HIPAA-compliant platforms that do exist. DoxyMe, Healthy, and WebEx for Healthcare are examples of HIPAA-certified platforms that can protect patient health information. Additionally, the opposing side stated that there was a 55% increase in healthcare cybersecurity breaches, but this is not specific to telehealth. In the past years, we've also seen an increase in electronic medical records, which could be a factor in this spike. Lastly, interstate licensing laws do present a problem with regards to access to care. However, according to Article 1, Section 8, Clause 3 of the Constitution, the federal government has the authority to regulate commerce amongst states. The Interstate Commerce Clause would allow the federal government to regulate the practice of telemedicine within the borders of different states. Additionally, states can address this problem on their own by removing licensing requirements for out-of-state telehealth providers. Arizona is currently considering passing legislation to permit its patients to receive telehealth services from practitioners licensed in all other states. Both of these options do require more action, but as telehealth medicine continues to grow, these are feasible actions that can and should be done to further increase access to care, thereby eliminating inequalities that exist within America's healthcare system.
When looking at the convenience and accessibility of services, if the Telehealth Modernization Act was passed, it is important to note that this increase in convenience and accessibility is not the case for all Medicare beneficiaries. Medicare covers individuals ages 65 and older and individuals with disabilities. The Pew Research Center found that only 42% of individuals 65 and older own smartphones and only 32% own tablet computers. Telehealth requires a certain level of technology and proficiency to be effective in providing client-centered care. This age group that falls under Medicare coverage is likely to struggle utilizing and accessing telehealth as a healthcare services platform, therefore reducing the quality of care that they would otherwise be receiving in person. Using telehealth as a treatment delivery system does let the professionals see the patient and their home and gather real-time information about their environment. However, this data is not quantitative enough to determine home modifications or adaptations. That is why for these type of changes, the practitioner will travel to the patient's home in order to perform measurements, test current safety equipment that is in place, and have a hands-on approach to demonstrate and educate the patient on certain mobility safety techniques. Telehealth is not enough for these modifications and adaptations and could in turn pose a safety risk if there is not hands-on in-person training involved.
In conclusion, expanding telehealth coverage will increase accessibility and convenience for many clients, but there are currently barriers that may prevent this bill from being effective. For instance, telehealth would be a more useful resource if the Interstate Licensing Compact for Occupational Therapy was enacted across the country. Virginia was the first state to enact the compact in March 2021, but more advocacy and legislative action is needed within the Pennsylvania Occupational Therapy Association Political Action Committee and the National Center for Interstate Compact in order for Pennsylvania and other states to provide telehealth services across state lines. Additionally, a lack of education and understanding of legal and ethical guidelines regarding telehealth and HIPAA rules are currently putting private and confidential health information of clients at risk due to the use of insecure telehealth platforms. Finally, telehealth has proven to be ineffective for older adults and vulnerable populations with chronic conditions due to technological and medical barriers, which means expanding coverage may not be the most beneficial for their health. Telehealth may be useful for more clients if these barriers are addressed. However, legal, ethical, and professional repercussions may occur if these changes are not made by the end of the public health emergency.
As we have discussed today, there are clearly pros and cons to the Telehealth Modernization Act. However, we hope you realize that the pros far outweigh the cons in helping to reduce the spread of COVID-19, along with other infectious diseases to vulnerable populations, such as Medicare recipients. In addition, telehealth allows healthcare providers the ability to provide education to caregivers or family members without having to visit in person, as well as provide real-time evaluations of the home environment to address safety concerns and provide client-centered care. Finally, telehealth increases access to care for many individuals who may not otherwise be able to receive the care they need due to mobility and transportation concerns. This option provides patients the ability to conveniently receive the care they need in a safe environment. Telehealth should not replace in-person visits if available and accessible, but should continue to be an option for Medicare recipients if in-person is not achievable. This act specifically allows occupational therapy professionals to continue to provide necessary services via telehealth while remaining client-centered by enabling the client to participate from their home or location of choice. To help support this bill, advocacy is key. Reach out to your local representative or representatives on committees where the bill is currently being introduced. Some representatives include Lloyd Schmucker, John Joyce, and Mike Kelly, who are from Pennsylvania and currently are not co-sponsors of the bill. Please also consider sending a letter through the AOTA website to ask Congress to make OTPs permanent Medicare telehealth providers. In addition, stay up to date on the different policies AOTA is supporting and help to protect the profession of OT for our future clients.